Welcome to This Explainer. Today, we're unraveling the mysteries of one of the most common, yet frequently misunderstood viral invaders on the planet. We're talking about the Herpes Simplex Virus, or HSV. It's a really fascinating, highly evolved pathogen that acts as a silent spreader, often becoming a lifelong companion for the people it infects. We're going to break down exactly how it operates, from its initial microscopic invasion all the way to its physical symptoms. Okay, let's dive into this.
To properly demystify this virus, here's our roadmap for today. We'll cover 1. The silent spreader, 2. The virus life cycle, 3. Oral and genital symptoms, 4. Surprising infection zones, 5. Severe cases in newborns, and finally, 6. Diagnosis and treatment. Let's get right to it.
Section 1. The silent spreader, moving unnoticed. You know, the absolute most surprising thing about the herpes simplex virus is actually what happens when you don't see it at all. I really want you to think about this question for a second. How does a virus manage to spread to millions of people globally without anyone noticing? Well, the wild reality is that most of the time, when HSV infects someone, there are absolutely zero symptoms. None. It moves from one person to another completely undetected, which allows it to sweep through a population entirely silently. And it manages to pull off this stealthy spread through a process called asymptomatic shedding. While herpes is definitely most contagious when there are visible virus-filled lesions present, it doesn't actually need them to spread. The virus can shed directly into saliva or genital secretions, even when a person has no visible signs of a cold sore or a genital lesion. This invisible shedding, it's literally the virus's greatest secret weapon. And this brilliantly illustrates how we traditionally classify the two main strains of this double-stranded DNA virus. HSV-1 is typically associated with infections above the waist, so primarily the mouth and the tongue. Meanwhile, HSV-2 tends to cause infections below the waist, mainly the genitals. But, and this is incredibly important to remember, there is actually a massive amount of crossover here. Both viruses are entirely capable of causing infections in either location. Section 2. The virus life cycle. Setting up base camp. All right, now that we know how it spreads, let's go microscopic and see exactly how this virus sets up shop inside the human body. When the virus first lands on a new host, it kicks off what's called the lytic cycle. You can basically think of this as a hostile takeover of a cellular factory. First, the virus dives into tiny little cracks in the skin or the mucosa. Then it binds right to the receptors on the epithelial cells, essentially tricking those cells into swallowing the virus whole. Once it's inside, the host's own cellular enzymes are hijacked to transcribe and translate the viral DNA, building new viral proteins. These proteins get packaged into brand new herpes viruses, which then burst out to infect the neighboring cells. But here's the twist. The virus doesn't just stick to the epithelial cells, it also has a latent cycle, which is a total game changer. The virus actually infects nearby sensory neurons and physically travels up their axons all the way to the neuron's cell body. For the face, it heads to the trigeminal nuclei, which is a major nerve hub in the face. And for the genitals, it goes to the sacral nuclei at the base of the spine. And here's the truly amazing part. The virus doesn't destroy these sensory neurons. Instead, it settles into them, making it a permanent home for the rest of the person's life, and goes completely silent. Now, what's really interesting about this is that this silent, latent base camp isn't always quiet. From time to time, the virus wakes up, makes copies of itself, and sends those particles right back down the axon to infect the skin cells all over again. This reactivation is prompted by some very specific triggers, things like stress, skin damage, or coming down with other viral illnesses. While these recurrent episodes are usually less severe or even totally asymptomatic, they're the exact reason the virus is able to persist throughout a person's entire lifetime. Section 3. Oral and genital symptoms, the battlegrounds. Okay, let's zoom back out from the microscopic virology to the macroscopic level, focusing on what happens when the virus makes itself physically known. Before a physical outbreak even happens, your body actually gives you an early warning system. We call this a prodrome. It's a highly characteristic tingling or burning sensation that pops up 1 or 2 days before any actual blisters appear on the skin. Recognizing this prodrome is an incredibly important piece of the puzzle, both for patient awareness and, as we'll see a bit later, for treatment. So when symptoms do show up, it's a completely different ballgame depending on whether it's a first-time infection or a reactivation. An oral primary infection usually hits children, and it causes severe symptoms like fever, swollen lymph nodes, and painful oozing blisters all over the palate, gums, and tongue. In older kids and adults, it often looks more like pharyngitis, basically a really severe sore throat.
A genital primary infection similarly causes very painful ulcers and pustules. However, reactivations, when they aren't totally asymptomatic, of course, are much, much milder. Oral reactivations usually just cause a small cluster of blisters right at the vermilion border, which is simply the edge of your lip. Genital reactivations produce a few blisters that resolve rapidly, typically within about a week. And because the trigeminal and sacral nuclei serve just one side of the body, these clusters reliably develop on the exact same side as the affective nerve.
Section 4. Surprising infection zones, beyond the classics. Now, most people just associate HSV strictly with the mouth and the genitals, but this virus has some highly unexpected fronts. For instance, did you know you can get herpes on your finger? No, seriously, it's called herpetitic whitlow, and it happens when a fingertip or nail bed rubs up against an active lesion around the mouth or the genital area. It's a really bizarre, painful manifestation, and it perfectly highlights just how easily this virus takes advantage of tiny cracks in our skin. And having a highly contagious virus sitting right on your fingertip is dangerous because it acts as a perfect catalyst for something called auto-inoculation. This is exactly what it sounds like, accidentally spreading the viral infection from one part of your own body to an entirely new area. If you touch an active sore and then, say, touch your face or your trunk, the virus can dive right in and start a brand new infection cycle right there. Let's move to and see how this builds into some other really surprising, visually distinct manifestations. Because of auto-inoculation and intense skin-to-skin contact, wrestlers frequently get HSV on their trunk, head, or extremities, a pattern dubbed herpes gladiatorum. If a patient has burn injuries or atopic dermatitis, they can develop incredibly serious infections in those compromised areas called eczema herpeticum. The virus can even attack the eye, causing keratoconjunctivitis. This one is characterized by a very classic tree-like branching dendritic lesion right on the cornea, alongside pain, redness, and blurry vision. Section 5, Severe Cases and Newborns, the high stakes. All right, let's shift our tone a bit here because we need to discuss the rare but truly critical complications of HSV. These high-stakes scenarios really demonstrate just how deep into the body this virus can go. In really rare primary infections, or sometimes during reactivations, the virus can actually escape into the bloodstream and cross the blood-brain barrier into the central nervous system. When it reaches the brain, it can cause severe inflammation, leading to meningitis or encephalitis, and it specifically loves to target the temporal lobe. To properly diagnose this, doctors look at CTs, MRIs, and EEGs, and they absolutely have to perform a lumbar puncture. In these severe brain involvements, the spinal fluid will show a telltale increase in red and white blood cells, alongside elevated protein levels. The stakes are equally high for newborns. Now, the key thing to understand here is that neonatal HSV isn't usually transmitted while the baby is in the uterus. Almost all transmission happens during delivery, as the baby passes through infected maternal vaginal secretions. The illness then follows a strict rule of thirds, unfolding across a pretty frightening timeline. About 1/3 of the time, within 1 to 2 weeks, lesions pop up on the skin, eyes, or mucous membranes, often right where fetal scalp electrodes were attached. In another third of cases, by weeks 2 to 3, the infection hits the central nervous system, causing lethargy, irritability, and seizures. If left entirely untreated, these can progress to the final third, a disseminated infection that causes massive sepsis and failure of major organs like the heart and brain. Furthermore, for individuals with weakened immune systems, the risks are dialed way up. Because their body's defenses are lowered, this typically latent virus turns into a much wider, far more aggressive systemic threat. They experience way more frequent reactivations, vastly more severe symptoms, and the virus can even spread to entirely unexpected internal areas, causing painful lesions in the esophagus or even down into the lungs. Section 6, Diagnosis and Treatment, the counterattack. Let's end on a more empowering note by looking at the specific medical tools doctors use to identify and suppress this elusive virus. So the crucial point is, how do we actually fight back? Doctors generally diagnose herpes based on a simple visual check of the lesions, but they can definitely confirm it by looking for viral DNA with a PCR test, testing for an antibody response, or by doing a viral culture. While these infections typically clear up on their own in a couple of weeks, we have some incredible antiviral drugs to help the process along. Medications like acyclovir, famciclovir, and valacyclovir can be taken topically or systemically, and they actively work to reduce pain and significantly speed up the healing process. In life-threatening cases, these are even given intravenously at really high doses. But for the average person just managing recurrent episodes, timing is literally everything. Let's bring this full circle back to that term we learned earlier, the prodrome.
These antiviral medications are incredibly effective, but they work best when they're taken the very moment that tingling or burning sensation begins, before the blisters even have a chance to develop. It's a brilliant piece of medical strategy that stops the viral factory right in its tracks. We have tracked this virus from a silent, asymptomatic shudder to a lifelong companion hiding out in our sensory nerves. It's practically a masterclass in viral survival. So I leave you with this. With so many silent carriers all around us, how does understanding HSV's secret journey change the way we view the invisible world of viruses? Thank you so much for exploring this with me on This Explainer. Keep questioning, keep learning, and stay curious.